Thank you, Eran, and thank you all for coming today. I'm not going to show a typical presentation. I rather tell you a short story about a couple of friends of mine. This is Jack, and Jack has a problem. Jack is suffering from chronic DVT, which means that he has a tendency to develop a blood clot in his legs, exposing him to a pulmonary embolism or a stroke. Causing over 500,000 deaths worldwide each year, it is referred to as the leading cause of preventable death. This is Jack's mother, Sylvia, and she has a different problem. Ever since going through cancer treatment, she has been suffering from lymphedema, which causes her legs to swell. The same as over 140 million people worldwide. It can cause pains, ulcers, and excessive swelling like this. And that's Claire. And guess what? She also has a problem. Seems like I have problematic friends. Claire works in retail, and standing on her legs all day causes her varicose veins. These are veins that are on the surface of the skin that are enlarged and twisted. Claire is considering going through laser surgery, the same as over 100,000 people in the US each year. So my friends did what all of us would do, and they went to the doctor. And the doctor told them not to worry, because there's a simple traditional solution that is very effective to each one of their problems. It's called a medical compression stocking. It's a stocking. It's about knee-high, sometimes higher. And it works by compressing the leg to improve circulation, reduce swelling, and prevents blood clots from creating. So, of course, my friends became happy again. And the doctor gave each of them a prescription, and as the doctor's orders, they went out and bought a pair of stockings. And started using the stocking the first day and then the second one. But by the third day, 60% of them stopped using the stocking. That's because they're very tight, very uncomfortable, and very difficult to put on and take off. When the majority of patients are elderly or suffering from arthritis, either they have somebody to help them put on the stocking, or they just stopped using them altogether, making their condition worse, up to a point of surgery and beyond. The ones who do use the stocking, they just keep complaining about them. You see, the problem is, on one side, the tighter the stocking, the better it improves circulation, but the less comfortable it is. There's an ongoing struggle by doctors to balance the needs of patients' compliance and comfort with the needs for clinically effective levels of compression. It is amazing that even with the 60% non-compliance rate, the medical compression stocking market is estimated at $1.1 billion US each year. As the founder and CEO of ElastiMed, we decided to rise up to the challenge. We're developing an innovative compression stocking that is made from smart materials, that is easy to wear, comfortable, and it doesn't disturb the patient's daily routine. It works by actively compressing and massaging the patient's leg to mimic the contraction of the calf muscle to effectively improve circulation. Behind the scenes, we have smart active materials. Using our patented solution, we can use this material, manipulate this material into a thin rubber band that can stretch and contract according to an electric pulse. Applying the material within a stocking, you can see here, converts the contraction into compression. We have a very strong advisory board, including a material expert and key opinion leaders in the domain in the US, Europe, and in Israel. At the end of the day, it's all about the patients. We've talked to many doctors, physiotherapists, but especially patients. And the problem is very obvious. Because the compression stockings are so uncomfortable, patients don't use compression stockings. But the compression stocking is only effective if you use them. Our device solves this problem with an easy-to-wear, comfortable, affordable solution that is battery-operated, giving a more effective active treatment more similar to a sensation of a massage. Using our stocking, patients can better comply with the prescribed treatment, reducing the risk of blood clots, swelling, hospitalization, and possibly death. I imagine that most of you know people that are suffering from the same problems as my friends do. That's why we believe we can help a lot of people live a healthier and more comfortable life. And I'd be happy to answer your questions after the presentations. Thank you very much.